Hannah Anderson, welcome.
Hi, good to be here.
I'm so excited to talk to you. Senior Director of Policy for AFPI and Director for A Healthy America.
I know it's a mouthful.
Yeah, but it speaks to your gifts and probably your passion. So I just want to jump right in, talk about you. I don't really know you that well. The first time I got to meet you was very brief and rushed, and you were heading out of town, and it was a whole thing.
We had a good conversation regardless.
Great conversation. Yeah. But I want to get to know you a little bit better. And just, for the sake of our listeners, all my shows are on anything that has to do with health and wellness, which is everything. Yeah. I teed up kind of one of a conversation this morning about Homeland Security, and people are probably thinking, what does this have to do with a health and wellness show? Everything. Yeah. National security is like, we're not healthy or well if we're stressed out about what's going on at our borders.
I know. And healthcare, when you're a Republican, has for so long. I mean, I've been a Republican in healthcare my entire career. And it's always been about payment. It's been about reimbursement. It's been about saving the taxpayer money. And those are all really worthy things to think about in healthcare. But I think, this is what's been so impressive about the MAHA movement, because it's taken over and said people care about a lot in terms of healthcare. They care about the border, right? Yeah. They care about other people getting access to healthcare that we pay for as Americans.
They care about keeping jobs in our country.
They care about keeping jobs in our country. They care about the healthcare that they get through that. They care about, so again, you're so right to say everything kind of comes back to health and wellness. So that's awesome that you had the good conversation.
Well, I love it. And so, but everything we get to talk about is really what I'm passionate about. Really. So I want you to kind of talk about what's you have a history at AFPI. You're in AFPI in these I guess positions, leadership positions for sure. Tell me what the focus is, and how does it speak to your passion and what you love? I mean, just give me a little background about yourself.
Well, I mean, it's a dangerous question, because when you're talking to again, mouthful of a title, that just means that I love people. And I really love to nerd out on policy. So again, you've got a very dangerous job. You've got to constrain policy people like me into speaking very succinctly about something instead of getting in the weeds. But, I think I love AFPI because AFPI talks about what can we do, America First policy, make sure that all the policy recommendations that we're giving, they're not supporting programs for the sake of programs. Right. They're not supporting industry for the sake of industry. They're saying, how do we put America and Americans first in all these policy decisions? And I know that sounds so simple, but it really, for some policymakers, it's not simple.
It seems like even a lot of policy we just lost that we're doing this for Americans. Yeah. Right? And there seems to be so many other agendas at play.
It gets lost in the sauce. I mean, all of a sudden the news will pick it up and they'll start talking about the impact and kind of the second and third line effects. And I say, again, that's things that the president really cares about and focuses about. But he first and foremost, I mean, what I love about President Trump is his focus on the person. Mm-hmm. Why did he go to McDonald's? Yeah. Right? It's because he wanted to show people the value of work is there, whether you are a, entry-level staff at McDonald's to being a CEO of a, Fortune 500 company. Because what people do matters, and that's the backbone of America. So we're getting off healthcare, but regardless, I love working here because it is all about people in the policy development process and America First in the policy development process. Right. And that's so unique in DC.
It's so unique in any kind of organization that's helping, shape policy, if you will. There's tends to be quite a bit of agenda, but, it speaks to the leaders. It speaks to Secretary Rollins and Secretary McMahon and their heart. So let's get into what the focus of this new role that you've taken on. Just tell us about that. What's the focus? What are you excited about? What are you working on? And then we'll dig into the nitty-gritty of some of that stuff.
Absolutely. So as the Senior Director of Policy, I am so fortunate to kind of get back to some of the policy areas that, over time you kind of have to give up. Right. So to become a subject matter expert on healthcare, you have to give up kind of your passion projects in energy, economy. Mm-hmm. So those are actually ones that I've been able to take more of a leadership position on and just overseeing here at AFPI. And so again, those are things that impact the pocketbook.
Right.
So it goes back to people. What are our economic policies that we're putting forward really advanced? Are we making people wealthier? Are we giving people more opportunity? Same with energy. Are we really developing an America First policy on energy? Where can we combat green energy wokeisms? So I really love being able to be here and oversee, right? I'm not the policy expert, but I get to help guide and direct, which is really neat, and get to work with Chad and Laura, who are our senior most leaders on policy, and they have such a heart for it as well. So
yeah, that's, you mentioned something about, I think there's a lot of education that needs to be had about we're going to sidestep because it doesn't really matter. We can talk about whatever we want about the energy conversation, because there's just so much misinformation and there's so much negativity around this conversation from the media, as far as this administration doesn't care about that and doesn't care about the environment, and it's actually the exact opposite.
This is when we were, a few years ago, when the conversation was only about carbon emissions.
Right.
It was only about carbon emissions. It was about, how do we reduce down to zero? And what was always wild to me is that we were putting forward solutions that were the most expensive.
Yeah.
The ones that would hit American workers the hardest, would completely sacrifice our independence to Russia and China. And I said, why are we looking for these absolutist solutions that are going to have this much impact? I said, if I really care about this, if I care about clean air, clean water, I'm going to be looking for the most practical solutions, the ones that leverage America's strengths the most, not, again, hand it over to China.
Well, yeah.
And that's where Trump kind of brings us back to the reality of, if we want to reduce emissions, or if we just want clean air and clean water, it's American companies who are going to do that.
That's right.
We've brought common sense and normalcy back to this conversation, where the climate change absolutists were nowhere there. It just was an ideology to them. It wasn't actual practical.
There's a lot of ideology floating around. So let's really move on to something that is near and dear to my heart, and that's preventative medicine. My background in hospitalist medicine, emergency medicine, really, my big aha moment 16 years ago was every disease process I have treated this week in this hospital was an exacerbation of some preventable chronic disease, whether it's a stroke, diabetes, a heart attack, Alzheimer's disease, even many cancers. I mean, multiple patients that had chronic diseases. And of course, now we're seeing chronic diseases, and this is a big part of the MAHA movement that I love, more and more in children. Type 2 diabetes it used to be called adult onset diabetes because you never saw it in kids, right? So talk to me about that, your heart for that, what's going on here around that.
Yeah.
I'd just love to know.
And this is where Secretary Kennedy just has such a passion and a heart. And, when I was at the department, he would talk about how he prayed to God every day that he would get a chance to really address the chronic disease epidemic in children. Yeah. Because he never saw, we're having more obese children grow into obese adults, and more research is showing that, if you're obese as a child, just there's something about the memory of the cells.
That's right.
That keep you, overweight and struggle with weight for the rest of your life. And I think...
And it starts in utero now, we're seeing.
Really?
Yep. Obese moms giving birth to obese babies, and those changes in the DNA, it's called epigenetics, last a lifetime and generation after generation.
That is, see, and that's so helpful because we're actually getting more scientific evidence. Yeah. And then from the evidence, really being able to find the solution. Yes. And that's what I love about our new era of preventative medicine, is because for me, it's going to personalized diagnostics. Right. So I think a lot of people, myself included, have always struggled with figuring out, well, how do I keep the weight off? How do I keep it down? How do I eat healthy? Right. And it's just, it's a lot of information. Well, eat right, exercise, okay. But what kind of eating? What kind of exercise? I mean, I see on Instagram, and I know so many young women also struggle with this. What, is it cardio? Yeah. Is it weightlifting? Is it training? Is it high intensity exercise? Right. Is it just walking? Is it walking on a treadmill? Is it walking on a stair stepper? Right. What is going to be the best thing for me? And what I love is this new era of personalized diagnostics. Right. So I love the wearables.
Right.
I know everyone has like a different opinion, but I've got a Whoop on.
I have a Whoop. I didn't wear any of them. I have an Oura Ring.
Yeah, I have the Oura Ring. I use the function testing. And what for me, that has finally been an answer, right? So medicine is never just generally kind of do these things. Like you're a physician and you get kind of, what is your body telling you? Here is the personalized solution to that.
Yeah, I love it.
And so I think we've kind of entered an era where outside of insurance, you can go and find out what's going on inside of my body. Mm-hmm. What are things that, maybe I'm not about to careen off a cliff.
Right.
Right. But where are things, my function lab test showed, okay, you have some inflammation.
Right.
And there was a study that just came out a few days ago that said inflammation is one of for women, an indicator of heart disease in the future. Where it's not so much for men. Okay, well then how do I reduce my inflammation right now so that I don't end up with heart disease in the future?
100%. Yeah. And really and truly, inflammation is the root cause of all chronic disease, heart attacks, strokes, you name it. It's the root cause. Cancers, even Alzheimer's disease, inflammation is at the root. And what we're finding more and more in studies, and this takes it full back to MAHA and farms and food, is it starts in the gut. When the gut is unhealthy because of the standard American diet, which the acronym is SAD, never noticed, because it really is.
I didn't notice that. Oh,
SAD.
boy.
Yeah.
What a condemnation.
We're talking about speaking something into existence.
Yeah.
But it really is. And what we're seeing more and more is those dietary, with all the ultra processed foods and all the additives and all the dyes, creating all this inflammation, and that releases these chemicals in the body that increase the inflammation. So when you peel that onion back, it gets all the way back to prevention.
Yep.
Right. And so one of the things that I love about what MAHA is doing, and one of the first things we're talking about, what do I know? What do I believe? You guys are working on changing the food pyramid, the dietary guidelines. Can you talk a little bit about that and what's happening in that world?
Oh, and what's awesome is that we get to work with Secretary Rollins and Secretary Kennedy, and they have this great partnership, really trying to, one, demystify.
Right.
The old dietary guidelines, hundreds and hundreds of pages long.
Yeah.
And they have, they really are aspiring to get the dietary guidelines to something that one is no pun intended, digestible for people.
Yes.
But really simplify and go back to basics.
Right.
Ultra processed foods are not something, again, as a physician, that evolutionarily, our bodies are not designed to be able to process a lot of that food.
Yeah.
They break it apart differently.
Right.
And again, people smarter than me had to explain it very simply. Is like an apple is different than applesauce is different than apple juice.
Right.
And your body takes all of that, with the apple, the fiber and sugar wrapped up together, breaks it down more slowly, impacts your system differently than applesauce and then apple juice.
Right.
And all of our foods, kind of are processed in different ways. And so really, by this huge new uptake of ultra processed foods, we're really kind of ruining how our body is designed to process natural food. So I think one of the big things with the dietary guidelines, ultra processed foods.
Yeah.
I think they're going to really try and get into, find a landing ground on dyes, because we know that some of these dyes are harmful. And I think there's still a lot of work to be done to really understand to the extent on the dyes. But then also go back to things like whole fat milk.
Yeah.
And
Liz, hallelujah.
I know.
Can we talk about it?
One of the most sad things I ever heard in the whole, the food pyramid debate is that the dietary guidelines from when it was written back in the 90s, and I mean, I'm sure you remember, I certainly remember when it was, low fat diet.
Yeah, it started in
and
the 80s.
They did it for children.
Yeah.
And so this ideology seeped all the way down to little babies 1 and 2, to the extent that they changed the dietary guidelines, which then changed what they were giving our poorest kids, most vulnerable kids in Head Start.
Yeah.
So Head Start teachers were not allowed to give little 1 and 2-year-olds full fat milk. They had to give them skim milk. And there's some research.
Well, no wonder we have such learning disabilities.
Exactly. And so, they couldn't develop myelinated cells in the brain because they relied on fat.
Yep.
And they were using the food pyramid, which is saying
low fat.
Yeah. So that is, again, we're returning to normalcy.
Yeah.
Like, I am really looking forward to kind of what they're going to finalize. Again, I know at the department, they were working hand in hand because they both want to get back to like whole food, get out of the ultra processed, get the dyes out of the food, and really, put into your body like really clean ingredients.
Yeah, absolutely. And it's simple, but not easy, and you've said so much there. I just want to touch on a little bit of those. So one of the biggest things that we see since this low fat craze started in the 80s, and it really started with vilifying cholesterol, really. And, cholesterol being the villain, and we got to drop cholesterol, and then statin drugs came on market in the 80s. There's several things that we have seen increase exponentially in this country since we've started this attack on fat and cholesterol. Number one, the brain is made up of 70% cholesterol. So what are we seeing in our Alzheimer's disease patients? What are we seeing in our kids when we restrict fat? We see a shrinking of the brain. And then we see tangles, and we're going to start seeing Alzheimer's disease happen earlier and earlier because of the mass prescriptions of statins. Statins actually increase insulin resistance and decrease, obviously, cholesterol, which both decrease brain volume. The other thing that's interesting about the whole low-fat thing is when you take fat out of a food or you create a new food that doesn't have what it was born with in the first place, you have to replace it with something because it's not palatable. Well, what do they replace it with? Sugar. Right? And here we go with this addiction to sugar. So one of the things that we're seeing in kids that start out of the womb, some moms can't breastfeed, they got to go on baby formula. And we're seeing a lot of this start with baby formula all the way through childhood. And it's changing the palates of children where truly their palate is it's like anything. We get everything quick, because of these phones. Everything's just instant access. And it is changed the palate of these kids. And the best thing is just to not ever get them there. My youngest granddaughter now, her mom has, they decided she is not going to have anything unnaturally sweet, for at least her first year of life.
It's hard. So tough.
It's hard.
Because everything's got corn. I mean, God forbid she has to take any kind of like baby medicine. Because that also has all sorts of corn syrup in it too. So I really am so sympathetic to the moms who have to grapple with the challenges. Like, I don't have any children, but I do have a decent amount of nieces and nephews. And my brother and sister-in-law have to every day try and figure out how are they going to figure what's the lunch schedule, what's the snack, what are we going to do, how are we going to back that up? And I really, the MAHA conversation is not about demonizing the moms who've had to make the decision to say, well, I do need to get something quick, or maybe I do need to just get a box of mac and cheese, or maybe I do just need to get one of those little grain bars. And I grew up with a single mom, and she was always trying to figure out what was the most quick, easy decision that was balancing nutrition. And so I think, again, the secretary is calling on companies to voluntarily make the decision to take dyes out, to take some of the added sugar out, just, again, to support the moms out there who don't have all the time in the world to be looking on the back of the box and saying, is this healthy? Is this not healthy?
even just going back to the basics of, when, growing up for me, an Oreo cookie had flour, sugar, eggs, and cocoa. You know what I mean? Ice cream was just eggs, sugar, cream. It was very simple and didn't have all these thickeners and these guams and these words you can't pronounce. And so again, it's common sense stuff that I think is going to be, just really the driver there. So with the changes in the dietary guidelines, what are you seeing at the policy level? I'm sure there's challenges with this, things that we're not even thinking about.
And so first and foremost, I think it's how do you make it helpful for people? Right. How do you make it helpful for people? What do people even want to know about the dietary? Do they want the federal government to be the one and done resource on what is healthy and what's not healthy? Do they want it to kind of give some pointers? What do they want? And so I think that's one of the original conversations. I think secondly is most people don't know that the dietary guidelines are connected to a half dozen other federal programs.
Yeah, exactly.
So, any change to the dietary guidelines, like Head Start, federally funded program, Head Start cannot spend a single dollar of federal funds on food if it's not completely married to the dietary guidelines. So do we disconnect that? Do we want the dietary guidelines to be determining, what's called federal feeding policy across the whole government? I think those are the policy decisions that they're trying to work through. And then third, how far do we want to go? And I think there's a lot of willingness to go as far as possible, but there's also, I know a lot of people in the department, Secretary Kennedy included, Secretary Rollins included, are trying to figure out the balance of, do we have the science, right? Do we have the science on all of these different items? And we have emerging science, but do we have enough science to say, you know what, let's make the decision to say no more of this or that.
And then how do you even do studies? Because it's, there's ethics involved.
Yeah.
We're going to give this group of kids
we're going to
process food, and we're going to not get,
can you imagine?
Come on.
I'm going to give you red dye 40.
Yeah. We'll see
100%. Yeah. And see what happens. Oh boy.
Yeah.
It seems dangerous.
Yeah. See, so that's going to be tough. And there probably is a decent amount of literature, obviously, that supports whole food-based diets. There's comparisons. They would have to be retrospective type studies, which I'm sure they're out there. What I found because I'm an avid researcher, it's my passion, I'm kind of a geek for the literature, is that a lot of the studies, even when I'm looking for studies in things that I'm teaching about or lecturing about, they're buried deep.
Yep.
And one of the things that I think is super important for anybody that's helping with policy and helping making these decisions, and I'm sure they know this, but you have to kind of look, when you're reading studies, you have to look, where's the bias? Who funded it?
And my God, the fact that you're even starting to look for that is something that a lot of policy staffers don't do because it takes time.
It takes time. Yeah.
And it's not a very glamorous job. Yeah. A lot of these big, behind the scenes policy decisions and policy research end up me being hunched over my computer at 11 o'clock at night. Exhausted, sipping coffee, which, like 11 o'clock at night, it's not great. My cortisol up, big shot. And really just seeping through the research.
Yeah.
And so it's tough to kind of be countercultural.
Right.
And thank God, again, Secretary Kennedy and Secretary Rollins and the president have all said, no, this is so important.
Right.
We need to get to the bottom of this.
All hands on deck.
All hands on deck.
One of the things that I get asked a lot, and, it's so logical to me, but I don't even know, is this something you've heard about or even possibly even be thought about, is addressing the marketing practices on ultra-processed food like we do cigarettes. And, why don't we have warning labels on a can of Coke or, a package of Doritos?
An amazing question, because this is the intersection of so many different, long-standing concerns. So I think people would be very supportive of labeling. I think where people get, especially Republicans, people who have been free market, limited government, are saying, well, should we make them put the labels on? What should we make them say? Should we make it for all food or certain food, or what are the criteria? And I think this is again, President Trump and Secretary Kennedy and Secretary Rollins are trying to encourage voluntary commitments, voluntary action. Say, can you put some of these ingredients? Can you on the front of the label? Can you call out some of the health factors in the food? Can you do it voluntarily, as a show of support instead of us making you do it? Because again, I think everyone is free market conservative.
Sure.
They want to make sure that we're not,
understand, but there's also, where's the freedom for the consumer when they're not given all the information? And, and I think, is it going to take this massive lawsuit like we had in the tobacco industry to force the hand? And that way, at least as a consumer, I know if I pick that up, because right now moms are being falsely marketed to with, it's 100% daily value of vitamin C and gluten-free. Well, if it's just, it's steering you down. And I had a Costco pantry for my kids, growing up. I believed the hype. I needed healthier choices that were quick snacks for my kids. 100% oats, and I didn't really at that time pay attention much to the labels until, I started seeing body composition changes in my own kids. Yeah. Right. And then you kind of start going, this is interesting. So just, even just transparency. Yeah. If you want to, if we want to have a free market and these ultra processed foods are here to stay, then the consumer needs to be made aware of the potential dangers of contributing to disease.
And that's where I completely agree. Yeah. It's the transparency. And this is the broader MAHA movement is how do you get transparency? How do you get more education? How do you get a more supported consumer?
Right.
I love what, again, Kennedy and Rollins are doing on this issue because they're looking for voluntary ways. They're looking, they put, nerding out for a second, what's called the unified agenda, where they are required to say all of the regulations that they want to put out for the next, couple months. And what ended up on the unified agenda is a front of package labeling requirement. So it shows that they're moving forward, to your point, and saying, how do we make this more transparent for the American consumer? In tandem, again, I can tell you from my time at the department, Secretary Kennedy really wants to figure out anyway, not just a labeling, what kind of apps, what kind of websites, what kind of, scanning things to say, this has, if you're concerned about gluten, this has, an unsafe level or an unhealthy level. What does this label mean? And then also, like, another thing is we should really, what is the USDA organic label? Like, what is, I rely on that. I go into the store and I say, okay, USDA organic.
What does that even mean?
What does it mean? So I know, like, Secretary Rollins and Secretary Kennedy have got a lot going on, so I'm not going to fault them for not getting into this just yet. But making sure that the American people know, if it says USDA organic, what does that mean?
Yep.
If it says, free of XYZ oil, what does that mean?
Yep.
And I think that's really important because, again, the moms are looking for, they're going to do a little bit of work on their own, but they do need, the government's help in actually providing that transparency.
Transparency, that's what we need, the transparency, because we can't make good decisions for our families and ourselves, for that matter, without that transparency. There's a couple of things that are interesting on here. And, I love what Tate and I had a conversation earlier, and we were talking about something that you just said around transparency, and I lost it, but I'm going to grab it back here in a little bit. What else on this MAHA? There's a reforming healthcare practices, talking about addressing over-medication, misleading drug ads. Can you speak to that a little bit?
I think the over-medicalization, I think is such a, let me back up, is America has had incredible advances in medicine and different therapies and treatments. I think what it has unintentionally done is pushed us to medicine as a solution to everything.
Correct.
And so I know when you see, and it's not a good problem to have, but my God, the fact that we have treatments for rare diseases that are extending children's lives by decades. Amazing.
Right.
But backing up is, do we need a statin? Do we need a blood pressure medicine?
Right.
I mean, my God, let me tell you, the amount of times people have tried to push me on blood pressure medicine at my time at the department.
Right.
I probably, I just told them, no, I just need to work on my anxiety.
Yep.
I need to go to the gym, get outside.
Work on you drinking coffee at 11 o'clock at night.
Yeah, that's probably it.
While you're
And what I have found was there are other ways, but we're so quick to say, here's the simple solution. It's going back to your phone. It's like, what is the quick win? Right. What is the quick solution? So the over-medicalization, I think, really the department is taking a hard look across the board. But the first thing that they're looking at is the SSRIs.
Yeah.
And you see, I know.
My doctoral work.
I know. It's wild. I have talked to people who have said SSRIs have absolutely saved them from the soul-crushing anxiety. And I don't want to be the one who says, no, you don't need it. Because, again, that's between them and their doctor and the Lord. I'm just going to say, I think the clinical evidence, and this is what, made me say, what, the SSRIs, I'm gonna pause on that before I go on them in times that I've had anxiety and depression, and say what has also been shown to have clinical evidence to reduce anxiety and reduce depression. Working out, talking with friends, church, counseling. Well, and so they see some of these items have really high clinical effectiveness in treating depression and anxiety outside of using an SSRI.
Right. I mean, I just saw, now that we're talking about this around my phone, these things will pop up on social media.
But they're always
there's all kinds of things that you could. But you know what's interesting? I love that you brought this up. You brought up SSRIs, and there's other things. SSRIs anxiolytics like Xanax, blood pressure medications, even ADD meds. These are just, for example, statins. These were all medications that were designed to be a temporary stopgap solution while you worked on figuring out and addressing the root cause. But what's happened, and this is why this MAHA point, this part of the agenda is so important to me, is it's become a way of life. It has become, this is just, I'm just going to have to be on this medication forever. No, it's not. And even in my world, this is what we train doctors on. This is what we do in our clinics, is we teach patients how to not need the medicines, get off the medicines, and looking at root cause for that. One of the biggest root causes, and this is coming out more and more in the medical literature, is the gut. And you take it back to the food, and you take it back to gut dysbiosis, bacteria overgrowth from ultra-processed foods and the SAD diet. And you take it all back to there. You don't see a lot of these problems in other countries. Now, when you talk about stress and anxiety, a lot of that has to do with 24/7 information, all of that. So we could just go on and on about that forever. But I love that they're even looking at it. Like, how are we now? So I got to tell a quick story, and I might have told this on another program. I don't know. I've interviewed so many people throughout the years, but I have a patient whose 2-year-old was just a hyperactive mess. And the pediatricians wanted to put this 2, almost 3-year-old on Ritalin, on ADD meds.
I'm sorry, how old?
2 to 3. It's not even FDA approved for that.
I thought I misheard you.
No, it's not even FDA approved for that. So she, of course, thankfully, just was like, she didn't feel right in her gut. And this is the one thing I encourage. Women are very intuitive. Moms are very intuitive. If it doesn't feel right, it's probably not right. That's God telling you no. But what she ended up doing is she started researching, and she just took everything that had a dye out of his diet. Just that. She just quit buying things that had any food dye. She's just like, let me start here.
Yeah.
Within a week, that kid who couldn't sit still for 2 minutes was sitting there reading a book or looking through a picture book, not reading a book.
Wild.
Root cause. So rather than going on this medication, which she would have kept him on for life, which has all kinds of other consequences, right? She figured it out. She took the time to figure it out. And unfortunately, what's happening in the medical community, pediatrician after pediatrician didn't help her, and they didn't know how to help her. And then they finally sent her to a neuropsych pediatrician that wanted to put the baby on the drugs. So it starts in her...
Ritalin.
Yeah. So I can give example after example. So this is a story just to maybe encourage you that what you're doing is important.
Well, no, to me, I hear this story. One, it breaks my heart. 2 to 3 years old. Lord have mercy. I mean, that breaks my heart. And then what I hear in the story is, again, I want to believe the best out of the doctors. And I think about my primary care doctor, who is phenomenal. And I think about what would help him sit and talk with me through stressful jobs. What can I be doing?
Right.
It's time.
Yeah.
He needs more time.
Right.
Because
more time and different education.
And I say, how can I support through my public policy work? How can I support better education? Great news. Secretary Kennedy is working on how to increase nutrition advocacy and nutrition training for all, especially when you're training to be a primary care doctor. It's
not
really
existent.
And that's so sad, because I would have assumed that is the foundation.
We train physicians across the country every month, about 500 of them. And one of the things, we train them on preventative medicine therapies. But one of the things we really talk about is nutrition. And when they leave, I can't tell you how many hundreds of doctors through the years have said, we get no nutrition training. And then another problem is that pharmaceutical companies should not have any influence or impact on medical textbooks or medical curricula, and they do, because that is a hugely biased area of education. Because now the modern day doctor that comes out of school is trained to write prescriptions, not trained to figure out the root cause of a chronic disease. And it's very, very different when
that's not why you became a doctor.
Right. Yeah.
And that's not... Yeah. And I sit with my doctor and I say, really, if you could wave your magic wand, what would you do? And he said, I would spend 45 minutes with you.
Yeah.
And so what I say is, first, thank God Secretary Kennedy is trying to right the wrong and do more nutrition training in these residencies. And second is, how can I support, through public policy, more time with my doctor? And it really, to me, it starts with trying to find other ways to finance my healthcare other than insurance.
That's leading to my next conversation.
I really just, health insurance has been so vital for so many people. It's kept people out of a massive medical debt.
Right.
It has been a godsend. And I will say, I'm not trying to demonize health insurance. I think what has happened to it has become the one and done, one size fits all only way to finance my health care.
Right.
And if I think about health insurance, why am I using insurance to finance something like a primary care visit? My primary care visit,
$150 visit.
Yeah. You shouldn't be using risk adjustment to figure out how many times I'm going to be going to the primary care doctor. You shouldn't be trying to figure out how to keep me from going to the primary care doctor, because that's what your insurance is doing behind the scenes, whether they want to admit it or not.
Right.
I should be able to have some sort of mechanism to go and see my primary care doctor and finance it in a way that's not using health insurance.
Correct.
So I love the model of direct primary care. And so again, this was one of the huge wins in the One Big Beautiful Bill.
Yeah, I want to hear about it.
And it's really just, again, going back to basics.
Yeah. Common sense.
Common sense. It's so common sense, it's innovative, which is wild. Yeah. Which is just making sure that if I want to use any of my healthcare dollars, one of them being tax preferred dollars and an HSA, HRA, FSA, all those dollars that we get through our health insurance plans, if I want to go and get a subscription, essentially, to a doctor, pay them $75 a month, call them whenever I need, go in, see them, spend time with them, or don't go in, right? Just call them and say, hey, I found some white spots on my tonsils. Do I have strep throat?
Right.
And it's so innovative that it just making sure that arrangements like that, where I get time with my doctor, are allowed under the law.
Right.
And President Trump delivered a huge win in making sure people had more ways of financing their health care other than health insurance.
Right.
And we need more of that because, again, I think people are so scared to not have health insurance. They think about, what if I get hit by a bus, or what if I get cancer?
Well, and that's what health insurance originally was designed for, was catastrophic illness. And when we went to the doctor, I didn't have health. My family didn't have health insurance growing up. We were blue collar worker. What's health insurance? The only insurance was Medicare, right? I mean, pretty much.
Yeah.
And so,
or like very limited.
Very limited, but it was more catastrophic. If I got hospitalized for a heart attack or cancer or something like that, it helped pay those bills. But imagine what a family of four that's paying $1,400 to $2,000 a month on health care, health insurance. What if they could shift some of those, because I hear this all the time, I can't afford to exercise. I can't afford a gym membership. I can't afford organic food. I can't afford. And shifting some of those dollars that they're just giving to the insurance companies and changing what this whole healthcare financing looks like. That's a really interesting concept, and I love that's come up.
Then, and what's really sad is that the family of four spends about $35,000 a year on healthcare. And
how much of that is insurance?
Almost all of it.
All of it.
What I hate is that if I'm spending, family of four, mom, dad, 2 kids, if I'm spending $35,000 a year and I have nothing to show for it, because it's $35,000 a year, you might not have seen a doctor a single time that year.
Exactly.
You may not have gotten a single prescription that year, but you spent $35,000 and your health insurance is paying for it. It doesn't extend. It doesn't roll over.
Right.
It's not like you have, I'm glad I'm paying it now because next year, what if something happens?
Yeah.
No, it restarts.
It's done.
It's a new $35,000.
It's not a savings account.
Right. So what I really want more people to do, if I could do anything, I would sit down with everyone in America and explain, here is how your health insurance works. Here is what it's good for. Here is what it's bad for. And if you are getting an HSA and you feel like you're spending more money, here's how you can actually make it work so that you're reducing your costs over here for catastrophic and really saving money just for if I get hit by a bus.
Yeah.
And here's how you can actually save money so you're not paying what I like to call a Groupon.
Right.
I think a lot of health insurance costs, they make you feel like you're getting such a good deal.
Yeah.
And I've sat with so many young women and men and said, you are overpaying for your health insurance because they're making it seem like, well, everything will be covered and it's $40 copay here, but you're overpaying because you're not going to go to the dermatologist that many times in a year. But they're making you feel like you've got such a good deal, and it's not a good deal.
Yeah.
It's a Groupon. So, one of the things that we're working on here at AFPI through the Center for the Healthy America and is really looking at ways to diversify. I want to give you more ways to pay for your health care than just health insurance. I don't want you to be paying new dollars. I want you to be using your tax-preferred dollars. I also want your employer to do a better job negotiating for you.
Right.
I get my health insurance through AFPI. I have been part of the conversations at AFPI to try and make sure that we're getting the best deal.
Yeah.
And big companies, like Fortune 500 companies, some of these companies are just taking an insurance plan off the shelf and their employees are overpaying by hundreds of thousands of dollars.
I see it in our own company too.
There was an example that one company, then this was Johnson & Johnson, was in the news because they didn't really shop around for drug prices, and they found that a like $17 drug, they were charging their employees $1,000 for it.
Oh my goodness.
$1,000?
You see that a lot though. You really do.
But we need to be better from our employers need to be better. We need to find other ways to pay for it, right? Like I would rather an insurance plan that lets me pay cash for things,
right?
Or gives me money to go pay cash for things.
Even, insurance plans that'll pay for compounded medications, some, which are much, much less expensive. You can take the GLP-1s, for instance. If you go into, your average CVS, you're going to pay $1,400 to $2,000 for that vial.
Yeah.
You go to a compounding pharmacy, it's $200 to $400.
Yeah.
But you can't use insurance there. It's still cheaper because even though you might be using insurance for this one, which it's not even covering anymore, it's still less than what. So that's a whole big conversations with medical freedom.
It's all medical freedom.
Medical freedom.
So the other part about me using my HSA, my HRA, my FSA is that I have a choice. Me and my doctor can decide how to steer the care.
Right.
Because as soon as I use my health insurance, there is a whole team of bureaucrats and technocrats saying, Hannah, you can't use this. Hannah, you can't use that. And there's some people, even in the party, who are saying, well, that's good because it's helping reduce costs. I say,
for who?
None of this has reduced costs. It has increased costs. It has made the quality of my care decrease.
Less, yeah.
It has made it harder to get health care. I mean, how many times do you get a prior authorization? You as a doctor, God, every day.
Yeah.
But me as a patient, prior authorization, utilization management, I'm like, look at how much I've actually used my health care.
And you know what ends up happening, because I see this over and over, like I'll order a diagnostic for a patient and then they want to use their insurance and all this prior auth, and then I got to go back and write a special chart note about that visit and make sure it has all the right diagnosis codes that match up and everything, and then they still get denied, and then they still have to pay out of the pocket, and they're paying their insurance company $2,000 a month.
And this was what kills me. It absolutely kills me, because if I'm a family of four making, mom and dad are working, maybe they're anywhere else other than DC, maybe they're hitting over $100,000. They're paying out the nose in taxes. Thank God for, again, the passage of one big beautiful bill to continue tax rates at a normal rate here. I'd say you've got $35,000 a year in healthcare costs. And on top of $35,000 a year in healthcare costs, you can't even use it.
Yeah.
We have health plans that are charging $12,000, $13,000, $14,000, $15,000 deductibles, which just means you have no health insurance until you pay $15,000 out of pocket. And that is Obamacare right now.
Right. Yeah.
There are plans on Obamacare, not a few,
most of them.
Most plans where you're seeing anywhere from a $10,000 to $18,000 deductible. Which just means you don't have any health insurance.
Yeah, and then the higher the deductible, but the lower your rate. Okay, great. I went from $1,500 a month to $1,000 a month. Big deal in the grand scheme of things. You just...
So not only that, you're paying, if you're a family of four and you're using Obamacare, and maybe you have one of the credits, you're still paying, maybe you're paying like $300 or $400 or $500 a month. So that's, oh my God, help me out here on the math. That's $6,000. So you're paying that $6,000 a year just to have health insurance, and then you have to hit $12,000 in your deductible. That's $18,000
Makes
before you have any health care.
Yeah, my husband, before he got into the industry with me 16 years ago in preventative medicine, he actually, health insurance and life and annuities was his thing.
Oh.
And he tells people...
Oh, so a real power couple.
Exactly. So he, he'll tell people right now, he doesn't, every time it's time to renew our insurance every year, he goes, don't renew it. Why are we renewing it? We can just pay for it because it's such a scam. And he says over and over, and he tells people all the time, it is the job of the insurance company to figure out every way to not pay for your care.
Yeah.
Not pay for your
And
care.
it's so upsetting because, really, again, my mom worked in the insurance space, and she would tell me growing up, she was like, this is not how it used to be.
Yeah, that's exactly
Obamacare
right.
changed all the rules, and it made it where insurance companies had to cover more things, which sounds like a good idea, but they do that by putting way more rules on insurance plans and your company when they want to offer it to you. And that's what, again, is frustrating, because if I could design my plan, it would be 100% coverage if I got hit by a bus.
Yep.
But I don't need all these little prepaid dermatology visits or prepaid whatever visits. I just would pay cash.
A la carte of your plan, on what's important for you. That's an individualized.
Exactly.
And at the end of the day, what happens with all of this insurance conversation is it goes back to what you started with, is the doctor gets less time. Why? Because not only do they not pay for stuff, but they're also not paying the doctors. That's why more and more doctors are getting out of insurance-based practices and trying to figure out how to transition into cash practices. However, one of the big trends we're seeing up and coming is, corporate doctors, most doctors out of school going into some sort of corporate medicine where really... It's a fine line between corporate practice and medicine and what they're doing, but they're requiring certain things, and they look at metrics from you as a provider and what are your prescribing practices and et cetera. And if they're looking at the wrong metrics, we really should be looking at how many patients did I get off their medications? Yeah. How many diseases did I prevent?
Yeah, no kidding. But that's so counterintuitive in healthcare. And so, again, just to that point is why I love working at AFPI is because there are some think tanks in D.C. that focus on the taxpayer. There are some think tanks in D.C. who focus on the market. And AFPI focuses on the patient.
Yeah, on the patient.
We think about the person and what is good for them. Low prices are good for them. Easy access is also good for them. Understanding prices is also good for them. And that's one of the hallmark things we have at AFPI is price transparency, which is, again, it's one of those common sense things. How did we get so far away from that? How did I get so far away where I can't shop around for my health care? Yeah. I am maybe one of the most savvy consumers of healthcare after working in this business for 12 years, and I still have trouble understanding how much I'm going to go in and get a service for before it actually happens. Yep. President Trump signed in law on price transparency that the Biden administration just sat on 4 years.
Wow.
Sat on it.
Didn't do it.
No problem. The folks down at the department working on this, they have their work cut out for them because they have to figure out how to unwind so much Obamacare nonsense. All the ways that they went further than even the requirements in Obamacare on health plans.
Well, and the crazy thing is I remember when Obamacare was rolled out and the promises even in his campaign of health care for all. Affordable health care for all. And what did we see happen? Insurance rates went up across the board. There were all these requirements required now for doctors and insurance companies and patients. And it added more regulation, as you know.
And I just want to, and just to be abundantly clear, because you and I are on the same page on kind of how Obamacare has warped the market, but I really do support the pre-existing conditions coverage.
Oh,
I support a lot of the things.
There's a couple of good things that were good in
exactly.
There.
So, but what people don't see is how, Obamacare really shifted all the incentives away from the patient. Yeah. And for a bill that was supposed to be all about the patient and reducing costs and protecting the patient, it really took all of the leverage the patient has and gave it to the government. Yeah. And really, we need to get back to a system. And this is why, again, AFPI is talking about price transparency because that's the first step closer to making sure that in a healthcare market, I'm the number one consumer, the patient. You're the number one consumer, the patient. And make sure that the market works for me. Because right now, I've got payers who work for providers, who work for pharma, who work for payers, and they all work for each other in this dastardly little triangle where I'm an afterthought as the patient. It's like, oh, well, Hannah over there, she'll just get what we take her.
Right.
No, I'm the patient.
Yeah.
Medicine should be personalized, individualized. You can't know what I need until you run diagnostics or you have a personal relationship with me as my 100%. Physician. So no, a little aggregate system over here where y'all are making decisions on my behalf, that doesn't work in medicine.
Yeah. Well, you can't put a patient in a box. And I want to say again, I've said it a couple of times, just today in different interviews, everything we're talking about is a bipartisan issue. Although partisan politics, have come into play, it really is because the health of Americans and the health of our children in this MAHA movement, all of it really shouldn't be
it's not
red or blue at all.
So. It's so important. Well, obviously I can talk about this for hours and hours and hours. So,
well, I just want to give you one opportunity. Is there anything else that, that we haven't covered, or if there's any one thing you would really like listeners to know and understand that maybe is misconstrued or misunderstood because of the way that maybe the media is positioning something, or just anything, final thoughts that you want to share?
Yeah. Your voice is so, like, people out there, and the voice of the people is so important.
Yeah.
We here inside the Beltway, the little way to explain our little highway system, we hear from the liberal media. We hear from, a very small group of elite woke, ideologues. We hear that everything we're doing is wrong and false and fake and all that. So your voice is really important because that's the one we're listening to. We're trying to listen to the voices of the moms who just want more information, the doctors who are like, finally, someone talking about, the care that we want to provide.
Right.
We want to hear from y'all. And so what's really important is to keep posting, keep talking, keep calling your congressmen, women, keep calling your senators, like keep doing that, because that is, it's not even a dirty little secret. It is what makes DC run, is hearing from folks all over America saying, keep up the good work, or can you tweak it this way, or can you work on this? So I would say keep up the good work. That the MAHA Mom movement is the best example of democracy.
That's right.
Like, that we've had in a while, is grassroots democracy saying, y'all pay attention to this.
Yeah. Awesome. Well, thanks for your time.
Thanks so much for having me. It's so much fun. Really appreciate it.
I can't wait to talk to you again, see what you're up to.
Absolutely. Thanks, ma'am.